Hello, and welcome to Riverside's Lung Cancer Awareness Month speaker series. Riverside is pleased to present a new community talk on a different lung cancer topic throughout November. Smoking is the greatest risk for lung cancer. Nearly 80% of lung cancers, as well as about 80% of all lung cancer deaths, are due to smoking, according to the American Cancer Society. In today's talk, physician assistant Megan Brown shows how smoking affects not only your lungs, but your entire body, and how when you quit, there are immediate benefits to your overall health. Megan?
Now, many of you may already know that tobacco use is the leading cause of lung cancer, but it is important to point out that it is also the leading preventable cause of all cancer deaths. But before going further on this and many other benefits of quitting, let's first start with the basics of smoking and vaping and the negative effects that these can have. Tobacco smoke is a toxic mix of chemicals that, when inhaled, can affect important processes throughout your entire body. When you light a cigarette or other tobacco product, there are over 7,000 compounds that you become exposed to. Nicotine is the main compound that comes to mind, which is the highly addictive part that leads to dependence. But you will also find carbon monoxide, which affects your lungs' oxygen carrying capacity. And there are about 70 different carcinogens or cancer-causing agents found in tobacco smoke. Some toxins you will find include ammonia, more commonly known as a bathroom cleaner, hydrogen cyanide used in gas chambers, sulfur dioxide, a chemical bleach agent, formaldehyde, which is an embalming fluid, arsenic found in ant poison, cadmium found in car batteries, acetone, which is in nail polish remover, naphthalene, which is in mothballs, and methane, which is a compound in swamp gas. And with that in mind, most people understand already that smoking causes inflammation to the lungs and increases the risk of lung diseases such as COPD, emphysema, and lung cancer. However, smoking can also lead to problems throughout essentially all other systems in your body. Smoking leads to cardiovascular disease such as coronary heart disease, hypertension, heart attacks, stroke, aneurysms. Smoking increases the formation of plaque in the blood vessels, which makes it more difficult for blood cells to move through arteries and blood vessels to get to vital organs like the heart and brain. It can also lead to circulatory problems and poor blood flow to different parts of the body, leading to things like chronic leg pain from poor circulation, poor wound healing, and even possible need for amputation in severe cases. People who smoke are 30 to 40% more likely to develop diabetes, and people with diabetes who smoke are more likely to have trouble with insulin dosing and managing their condition. Smoking makes you more likely to develop gum or periodontal disease. It causes tooth discoloration and decay and tooth loss. 40% of all cancers diagnosed in the US may have a link to tobacco use. Smoking can cause cancer almost anywhere in your body. In addition to the lungs, the risk of pancreatic, colon, esophageal, bladder, kidneys, cervical, breast, throat, mouth, liver cancer, and certain leukemias are also increased. Smoking can lead to problems with fertility in both men and women, with infertility rates about twice that of those in non-smokers. Pregnancy complication rates are also increased in women who continue to smoke. And men who smoke are also twice as likely to develop erectile dysfunction. Smokers are 3 times more likely to develop age-related macular degeneration and other eye problems as well. It is also important to remember that while smoking is a direct cause of cardiovascular disease and death, you don't have to be a smoker to be at risk. When family and friends are around people who smoke, known as secondhand smoke exposure, this increases the risk of developing lung cancer to them as well. Non-smokers are regularly exposed to secondhand smoke. Non-smokers who are regularly exposed to secondhand smoke have a 25 to 30% increased risk of heart disease than those not exposed. In fact, 30,000 US heart disease-related deaths per year are caused by secondhand smoke. Secondhand smoke exposure also increases your risk of having a heart attack or stroke. Secondhand smoke is not only dangerous for people, but also to your pets, who can have more eye infections, allergies, respiratory issues, and can even develop lung cancer themselves. We now also know of another category called third-hand smoke, which is basically the residue of nicotine and other chemicals left on indoor surfaces such as carpets by tobacco smoke. Those most at risk of third-hand smoke exposure include babies who may crawl on the floor and then place their hands in their mouths, as well as pets. While vaping seems more socially acceptable than smoking, it is also very dangerous and exposes you to very real and scary health risks as well. Vapors could be inhaling lung-damaging chemicals and metal particles into their lungs. E-cigarettes are battery-operated and create an aerosol for a user to inhale. When a person uses an e-cigarette, the liquid inside heats up and becomes the aerosol, which typically contains nicotine, flavorings, and chemicals, some of which are toxic. The e-liquids often come in flavors, but the chemicals used to create flavors can be harmful to your lungs. It is also unregulated, so different brands have worse chemicals than others. E-liquids contain lipids or oils that can coat and stick to the lungs and cause further problems to the lungs. Vaping can get deeper into the lungs than smoking traditional cigarettes and can cause the same or worse problems. E-cigarette aerosol can also contain other chemicals like formaldehyde, which can cause cancer, and metal particles such as nickel, lead, chromium, tin, and aluminum. Vaping can cause coughing and wheezing, as well as changes in the blood vessels, much like tobacco smoke, and the effects may be delayed, long-lasting, and even deadly. Unfortunately, many teens and tweens see their peers vaping, even in school bathrooms, classrooms, and outside the school grounds. Kids who vape are also more likely to start smoking cigarettes later. Most vapes contain nicotine, which is the same highly addictive product found in traditional cigarettes. When someone vapes, nicotine gets into their bloodstream through their lungs and travels to their brain within 10 seconds, causes a surge of brain chemicals called dopamine, which is known as a reward chemical. That means it makes the person feel good, encouraging them to vape some more. This is what ultimately leads to addiction, just like in tobacco. Teens and tweens are more vulnerable to addiction than adults because the brain continues to develop through a person's mid-20s. Some teens can experience symptoms of addiction just after a few weeks of use, even if they are casual users. Signs of addiction to look out for include cravings to use e-cigarettes or other tobacco products, feeling anxious or irritable, continuing to vape despite negative consequences, or going out of one's way to get e-cigarettes. Now let's move on to some more of the good news about the benefits of quitting. And with that, please keep in mind that no matter how long you have been smoking or vaping, it is truly never too late. This is a good visual because it shows a snapshot of some of the milestones you will experience when you quit smoking and the health benefits you can look forward to, starting within minutes and continuing for many months to years after you quit. Within 20 minutes, your heart rate and blood pressure drop back towards normal. Within 12 hours, carbon monoxide, that chemical that impairs your lungs' ability to carry oxygen, drops to normal. In 5 days, most of the nicotine is out of your body. You may have increased cravings during this time. However, there are nicotine replacement products such as the patch or gum that can help in many cases. In 1 week, you may find improvement in your sense of taste and smell. In 1 month, your skin appearance is also likely to improve. Within a few months of quitting, your lung function improves, you will cough less and breathe easier. When you quit, your risk of heart disease and heart attack declines exponentially. In 1 year, your risk of heart disease is cut in half, and in 15 years, your risk is the same as someone who has never smoked. If you have diabetes, within 2 months of quitting, insulin becomes more effective and you are better able to control your blood sugar levels. Quitting smoking reduces your risk of developing gum disease and mouth cancer. It improves the look of your teeth and lessens your risk of cavities. And quitting smoking not only lowers your risk of developing lung cancer, but also lowers the risk of many other cancers as well, including pancreatic, colon, esophageal, bladder, cervical, and throat cancers. Quitting can also improve the outcomes for cancer patients even after being diagnosed, as opposed to those who continue to smoke through their diagnosis. Quitting smoking is one of the best natural ways to increase fertility. Women who stop smoking double their chances of getting pregnant each month. For males, by quitting smoking within 2 to 12 weeks, as your blood pressure and circulation improve, erectile dysfunction can also improve. Quitting smoking will reduce your risk of developing different eye problems as well, including macular degeneration, cataracts, glaucoma, and diabetic retinopathy. And when you quit smoking, your night vision may also improve. As you keep all these things in mind, I encourage you to take that first step and commit to quitting smoking or vaping. And remember why you are quitting. In addition to all the health benefits, think about other things that might motivate you even further. These might include being around for your family, reducing the risk of secondhand smoke to your friends and loved ones, having a better quality of life overall, and being able to stay more active in certain hobbies you enjoy. In this process, it is important to find support along the way, whether through family, friends, a healthcare provider who can help develop a quit plan and provide other helpful resources. And finally, remember that many ex-smokers try stopping multiple times before they finally succeed. So don't let a slip up get you down.
Thank you, Megan, for sharing this valuable information with us today. Quitting smoking at any age will lower your risk of developing not only lung cancer, but it lowers your risk of developing many other cancers as well. Riverside encourages you to speak with your healthcare provider for support with setting up a quit plan for your goal to be smoke-free. It's never too late to quit smoking. For more information about lung cancer screening and early detection, visit us online at riversideonline.com/lung screening.